Hi everyone, this is Ashley and Bree's presentation on social networks and social support. Overall, social networks and social support describes the structure, processes, and functions of social relationships. A social network and social support are two separate entities. A social network is a web of social relationships that surround individuals. It is made up of linkages between people that may or may not provide social support that may serve functions other than providing support. These social networks give rise to various social functions. Social networks are described using two types of characteristics. One way to describe a social network is through characteristics pertaining to specific relationships between the individual and other people in the network. Networks can also be described using characteristics of the network as a whole. There are 8 constructs of social networks. One is density. Density is the extent to which network members know and interact with each other. This determines if entities within someone's network are interrelated. It is used to figure out if different people in someone's network use the same resource and come into contact with each other. Another construct is homogeneity. This is the extent to which network members are demographically similar. This determines if someone belongs to a diverse group of people or does everyone or mostly everyone in the network share similar characteristics such as age, race or ethnicity, marital status, etc. Geographic dispersion is another construct. This is the extent to which network members live in close proximity to the focal person. Graphic dispersion determines the location of those who provide the individual with social support. This could be family or friends' houses, physicians' offices, etc. Directionality is an additional construct. Directionality refers to the extent to which members of the relationship share equal power and influence. Power dynamics in various relationships, such as patient-provider or husband-wife relationships, are determined. Another is reciprocity. This is the extent to which resources and support are given and received. Both individuals in the relationship give support to the other when needed when reciprocity is shown. Next is intensity and strength. These show the extent to which social relationships offer emotional closeness. The emotional bonds between a spouse or parents are likely stronger than the emotional bond between coworkers. Another construct is complexity, which is the extent to which a single social relationship may serve many functions. A close friend of an individual may also be a coworker. The friend can play both roles as a supportive friend and help with work-related responsibilities. The final construct of social networks is formality. This refers to the extent to which social relationships exist in the context of organizational or institutional roles. The relationship between an individual and their physician exists in the context of the patient-provider relationship. Social support is another part of social relationships. Social support is the functional content of relationships that can be categorized into 4 broad types of supportive behaviors or acts. Social support is always intended to be helpful and consciously provided. It is provided in the interpersonal context of caring, trust, and respect for each other's right to make their own decision. There are 4 constructs of social support. The first one is emotional support, which includes expressions of empathy, love, trust, and caring. Close friends and family provide the individual with someone to talk to, show emotional support, and provide encouraging words. The second construct is instrumental support. This refers to tangible aid and services. It helps the individual by providing a useful service they may need, such as babysitting, transportation, cooking, running errands, taking care of pets, or loaning money to them. Next is informational support. Advice, suggestions, information make up this construct. Health professionals provide facts about a disease or illness and can also provide guidance during the course of a treatment. They can also inform patients on preventative health practices. Friends and family can also offer advice and suggestions from their own experience or knowledge. And the final construct is appraisal support. This includes information that is useful for self-evaluation. Friends and family can remind the individual of their specific qualities and characteristics to help them accurately assess their situation. This is a conceptual model to represent social networks and social support and their effect on health and well-being. Pathway 1 represents the direct effect that social networks and social support can have on overall health. Social support may meet the basic human needs for companionship, intimacy, a sense of belonging, reassurance of one's self-worth. Having these needs met may help enhance overall health and wellness even in the presence of stressors. Pathways 2 and 4 represent the possible effect that individual and community resources may have on health. If a person has greater access to information and resources, they may feel as though they are better equipped to handle different situations and obstacles. Pathway 3 shows the relationship between stressors and social networks and social support. By having supportive ties with people, they may be able to decrease the amount of stressors you come into contact with and also decrease the duration of a stressor. With having less exposure to stressors, this leads to improved overall health. Pathway 5 shows how social networks and social support may affect health behaviors. A social network may influence an individual to partake in preventative health behaviors and therefore decrease the amount of disease as well as decrease recovery time for individuals. So studies have consistently shown that patients with heart disease are at higher risk for subsequent cardiac mortality and morbidity if social support is not adequate. In the Enhancing Recovery in Coronary Heart Disease Patient Study, cognitive behavior therapy is used to increase social support. There were 2,481 participants in the study. They all had recent myocardial infarction and either depression or low social support. For those with low social support, a therapist assessed the patient's social support system in detail to determine specific needs to be addressed in counseling, whereas the control group received the usual post-cardiac incident care. The therapist provided short-term counseling to guide patients on enhancing social networks, such as strengthening existing relationships. Group sessions were also held with about 5 to 8 participants each for informational and emotional support. They found participants in the intervention group experienced a significant increase in social support compared to the control group. But during the 4-year follow-up period, the intervention group unfortunately did not appear to have a decrease in the number of fatal or non-fatal myocardial infarctions, but investigators admit that the magnitude and the duration of the increase in social support achieved in this trial may not have been sufficient to protect against subsequent morbidity or mortality. So the advantages of this model, social networks and social support, is more of a model than a theory. Therefore, it can lend itself to other theories from various fields. The model also acknowledges the bidirectionality of hypothesized relationships. Some of the limitations, because the definitions vary widely, terms in this model are often used loosely and interchangeably. In studies, it is usually unclear as to which pathway is being investigated, as well as the entire pathways are usually not investigated appropriately. And what we feel is the most appropriate use of the theory, so it can be used in healthcare by providing informational resources such as well as resources about support groups to patients to better equip them to cope with their diagnosis or disease. Partners or significant others can be incorporated into smoking cessation or weight loss programs to increase support for behavior change. It can be appropriately using communities by providing lists of community resources. So they have places they can reach out for assistance if needed, as well as used to strengthen workplace relationships, possibly provide a workplace contact list, a board that lists other resources people offer, have connections with, and hold employee events. These are resources, and thank you all for listening.